Well, good morning, everyone. A special thank you to Monica Hendrickson and the staff of the Peoria County Health Department for hosting us today, and maybe more importantly, for working to see Greater Peoria through this past several months as safely as possible. It's truly great to be back in Peoria, and I'm also grateful to Mayor Jim Ardis and County Board Chair Andrew Rand, Leader Dave Kaler, Representative Ryan Spain for welcoming me here again today. I'm here because the most impactful change starts locally. I'll be frank, we need to see some change here in the Peoria area when it comes to the COVID-19 pandemic. As much as I'd like to, this virus isn't something that we can wish away. So we have to act responsibly and collectively to protect the people that we love. To date, relative to most other states, Illinois has seen real success in handling this pandemic. But it doesn't take long to see that trajectory of success turn around. And right now, things are not heading in the right direction. As of Wednesday, our current statewide 7-day rolling positivity rate is 3.8%. Here in Region 2, which includes Peoria, that rate is 4.3%, with 7 days straight of increases and 3 days of increases in hospital admissions. And I'll remind everyone that the health metrics that we set for a return to tougher mitigations is 7 out of 10 days of increasing positivity rate plus a sustained 7-day increase in hospital admissions. So if this region has 4 more days of people getting sicker and needing a hospital bed, that means bars will close again, and a possible reduction of service at restaurants, and smaller capacity limits on other activities. The specifics of the reversal will be determined and dependent upon the types of activities that are most likely causing or could cause greater community spread of the virus. As updated recently, we have 11 regions in our Restore Illinois plan, most of which are inching up on several metrics. Peoria is just one of 4 counties out of 102 that is now on the warning level by the state's Department of Public Health, because you have an increasing level of emergency department visits related to COVID-19 and increasing numbers of new cases. Much of the increase in cases has been tied to the 29 and under population, large social gatherings, and also household spread from family member to family member. I was pleased to see that Monica Hendrickson and her team of public health professionals issued new advisories and increased visual mitigation reminders recently as Peoria has seen dangerous rises in its health metrics. The Peoria Public Health Department and IDPH both have the same goal here and are working together toward that goal, and it's keeping the people of Peoria and all of Illinois safe. With a situation like this, it's critical for local leaders and residents alike to constantly evaluate the situation on the ground at a more granular level. That's why we've provided you with local information about the spread of COVID-19 in every county on the IDPH website at dph.illinois.gov/county metrics. I'm going to repeat that for anybody listening in who wants to write it down, dph.illinois.gov/county metrics. And you can also find this data on your local public health department website. Believe me, I know firsthand that these decisions are difficult. Often it's a choice between something bad and something worse. But I also know that local action can be much more surgical, like in Sangamon County, which is stepping up to more proactively enforce bar and restaurant capacity limits. Taking early action will protect community health and save jobs in the long run. And just as importantly, each of us has to take responsibility too. I want to urge Peorians to follow the mitigations more rigorously. Wear a mask everywhere you go in public. Do not enter a bar or restaurant or any enclosed space if it looks crowded. And keep 6 feet of physical distance. Wearing a mask is like wearing a seatbelt. It's required, and it saves lives. Another thing you can do, if the Peoria Health Department calls you, please answer your phone. They are likely calling to do contact tracing, which will help us slow or even stop the spread of COVID-19. Contact tracers are calling to let you know if you've been exposed to someone who tested positive, to tell you where you can get tested, and will give you valuable information that will keep you and your family healthy. Folks, this virus is extraordinarily serious. In other parts of the country, people are dying at alarming rates. Infections are rising in the South and the West, in every one of our neighboring states, and right here in central Illinois. 150,000 people have died in the United States in just 4 months, about a third of a year. This is our moment to pull together, to protect the progress that Illinois has made since the beginning of this pandemic, and to keep our families, our friends, and our neighbors healthy and safe. Thank you, and now I'd like to turn it over to Illinois' own leader of our Department of Public Health, Dr. Ngozi Ezike. Doctor?
Thank you, of course, to you, Governor, and good morning, everyone. I want to thank Monica Hendrickson, the Peoria City County Health Department Administrator, for hosting us here today, along with our local leadership. This is a very challenging and important time. In addition to all the healthcare workers and providers, the local health departments are also on the front lines working to keep communities healthy and save lives. Doing what needs to be done to keep people safe doesn't always win you popularity contests, but it's still the right thing to do. I have talked to friends who've said that they felt, since no one else was wearing a mask, they felt uncomfortable putting on theirs. If adults can't overcome the peer pressure to wear the mask, I'm not sure what we expect from our kids, so we have to set the right example. We know that keeping our distance from other people helps reduce the risk of exposure. Similarly, wearing a face covering helps reduce the risk of spreading when someone is unknowingly infected. The clear trend in our state and in the country is that we are moving towards universal mask wearing. So thank you for everyone who has already adopted these measures. We are not tone deaf to the struggles that people are facing and the desire to just get back to normal. But we ask you to be as safe as possible as we learn to coexist with COVID. Right now, restaurants and businesses are open with limited capacity. Some recreational activities are resuming with measures in place to reduce exposure and spread. There is nothing that can completely eliminate risk. People are returning to work, but with that, as we see more cases across Illinois, it just highlights our need for these important mitigation measures. We are seeing hotspots, as the governor mentioned, not only in the numbers of new cases, but also in the numbers of admissions to our hospitals. So we're trying to do all that we can so that we can keep businesses going, but there may be a point where we reach a certain threshold where we have to reduce capacity again temporarily. Maybe restaurants will have to go back to takeout. But we can avert this with our individual action. I know that changing behavior is hard. Maybe other communities and other countries and other continents had already this culture of using masking. So we're adopting something new and we're getting it. We will start to wear our face coverings as we gather. We will avoid crowding into bars and stores. We know how critical it is. We've seen it work in other places, and we're going to have that same positive effect as we continue its uptake. I know we're tired of hearing it, but it's still the same 3 things. Wash our hands, wear our face coverings, and watch our distance. In mid-May, we reported more than 4,000 cases in a single 24-hour period. and 191 deaths over a 24-hour period at our peak. Yesterday's numbers gave us 1,400 new cases and 18 deaths in the 24-hour period. We want to not reverse our progress. We know what it takes to slow the spread. We're learning how to do it. We're going to take it up quickly and be part of the solution, not the problem. Thank you for everyone's continued support in this important measure.